Hi everyone. It's not every day that we have two veteran CIOs of two India's leading hospitals together on the same floor with us. So I have with me Mr. Arvind Sivaramakrishnan, Group CIO of Apollo Hospitals, and Mr. Kumar KV, Group CIO and CISO of Narayana Health. Thank you so much, gentlemen, for joining me. Now I want to ask, in terms of the healthcare industry, the healthcare landscape, what do you see as the biggest cyber threats, which or let's say the top three cyber threats impacting the healthcare industry today?
Uh, Shipra, I think I won't say top three, just top one. Healthcare has got personal information, and personal information is of deep interest to people. So, the straight threat there is how to get to somebody's personal information so that you can do other things with it that are normally socially unacceptable but have a good impact value in a very negative sense. So that's really the topmost problem that the whole healthcare industry is dealing, protecting that pristine personal information that people have trusted us with. I think that's really the big problem that all of us are responsible for and all of us are dealing with also.
So adding to what Arvind has told, a PHI basically costs $330. In one of the recent estimates was it costs $330 compared to a regular information that is there. So when you say top three threats, first thing is since you're dealing with personal identifiable information, sensitive personal information, ransomware attacks basically comes to our mind. If something like that happens, entire hospital basically gets locked out. Then privilege management or identity access management is the second threat that is actually there. So subversion of privilege basically can lead to other compromises. And third is data breach in any form, whether it's be internal as well as external, are some of the key threat vectors which we actually see on the healthcare industry.
So, considering that personally identifiable information is actually at the core of any healthcare security strategy, now with the upcoming personal data protection bill, how do you think that is going to impact your cybersecurity strategy? How are you going to relook at your own data protection, or rather data privacy aspect of your data?
See, when you look at the PDP bill that's coming, it's something that is required for the industry, it's required for the citizen, it is required for the overall practice. So, it's definitely the right thing to do and the responsible thing to do. How are we going to look at it? I think we're going to look at it from the inside out and outside in. There's a lot of measures that you have to take within the organization to make things robust. Robust by design and robust also by culture. See, one is your design is very good, your solutions are very good. But then the insider threat problem of dealing with information in a not very mature way is, I think, paramount. So you got to deal with it. Then you got the outside aspect of it where you have to ensure that you're setting the right expectation and you're dealing with the right expectation. Otherwise, you're going to get into an issue of excessive over consumerization. And that also is not going to be comfortable for an organization to run. So setting the right expectations, behaving mature, building security and privacy into the culture of the organization, and fundamentally relooking at our entire architecture and solution offering for the design, and making sure that our talent is well capable to support all of that. So I think it's going to be a good level of revamp within the Sting organization to meet it, a good level of revamp on mentality of the consumers to also relook at privacy and security.
No, I would actually put it as in adding to what Arvind has said, organization should basically take a data-centric approach. So, like how we put when you talk about patient experience, we put patient at the center and basically then look at the ecosystem. When you talk about privacy and security, we should put data, what we are actually dealing with, from where it actually comes, and basically map out all these controls and look at from that perspective, build out the entire architecture and then see where all these appropriate controls have to be baked in. I think that would be the way forward for organizations to take the journey. The other two important things is IT is not the owner of for any privacy engagement. It's an organizational initiative, and we say data. Data is not about data which is there in those IT systems. Data starts right from the data which is there, or or the data that is there in the dustbin, all the way to the notice board, so which also includes IT systems. So that is what data means, because today data is all pervasive. So if organizations look at these three aspects and they follow that, I'm sure they will be able to move, or I would say make substantial progress in their privacy journey.
So, the IoT attacks that we are seeing, I think that is one of the biggest threats right now to the to any hospital, and it is something that can have devastating effect. It can impact on the lives of people. So, what do you think in terms of the next wave of attacks? Are they going to be mostly on the IoT systems, on the critical hospital systems that are there, and or do you think that is something that will continue along with the other attacks as well?
I won't necessarily put it as IoT attacks. I think people are looking for the point of vulnerability. So it's not necessarily going to be something that is very visible. It can also be something that's silent, on which probably you're not putting your right attention, and thereby it's got some loophole of entry. So overall, it is any equipment that is exposed to a public network, or any equipment that has a indirect channel and path to a public network. All of them need to be looked at, very seriously hardened, and layers of protection done in terms of managing them, and periodic verification of that. You can't, this is not something where we do it once and say it's all good. Things keep changing. This space is changing by the minute, literally. So I think we'll have to look at any equipment. IoT is a buzzword here, but IoT is not the front, right, and center.
Yeah, very rightly. IoT is just one of the many doors that are actually there in an organization. So the attack can actually literally happen from anywhere. So organizations which basically take a 360-degree view of the entire security architecture, and then plan initiatives to address that in a structured manner, because I'm very sure no organization can do all things at once. Rome was not built in a day. So if there is a proper strategy to build out this architecture, I'm sure that organization will be able to ensure that appropriate controls get baked in at multiple layers.
So my last question is, what is your next priority for? We are almost in the middle of 2022. So for 2022 and beyond, let's say 2023, what is the next big thing on your priority, the topmost priority for you?
In nothing big. What we have, maximize the adoption. Look for effectiveness in every operation, and look for entire operational workflow, clinical workflow excellence. By doing it, we will be able to assess the gaps of our own organization. This is not about, this is the thing, trend going on in technology, we need to bring it in. Don't ask me the question in terms of where is metaverse going to come and sit here. Very difficult to answer, because all those can be answered when I know where in the organization workflow it fits. So to me, the biggest priority will be what we have, maximize it. Gives me insights of what are logical gaps, or where probably we didn't solution right. We have a solution, but it's not working right. I think more that feedback loop is really what's the priority. Maximize it, and then figure out and plug the gaps, or redesign if they are not effective to us.
Use what you have to the fullest extent possible. Drive adoption of whatever that has actually been rolled out. See if we can do better on whatever that has also been, whatever we actually have with us. And when we design these systems, take a human-centric approach. Always think of the stakeholder who's going to use the system, and don't forget to bake security and privacy controls in any solution that we actually build in. Thanks.
Thank you so much for your time. Thank you, Arvind sir.
Thank you, pleasure.
Thank you, Kumar.
Thank you. Thanks, Shipra.
Thank you.